Thank you for your interest in this presentation, which is on the topic, Motherhood Statements Don't Count, Dollars and Delivery Through Gender Budgeting for Breastfeeding. This meeting is being hosted on the traditional lands of the Ngunnawal people. The Indigenous women of Australia have been living, working, birthing, breastfeeding and successfully raising children on this country for tens of thousands of years. Their skills and knowledge about infant feeding and young child feeding, including breastfeeding and safe complementary feeding, have been key to their health and survival. However, policies and practices imposed on Indigenous people during the last 200 years or so have badly disrupted the economic, cultural and social environment for traditional breastfeeding practices. Indigenous children in Australia are now less likely to be breastfed at every age than non-Indigenous children, including in remote as well as urban locations. I would like to acknowledge and celebrate the first Australians on whose land the Australian National University sits and pay our respects to the elders of the Ngambri and Ngunnawal people, past, present and emerging. And I hope our work contribute to advancing their goals and fulfilling their human rights. So a brief overview of this presentation. I'm going to talk about human rights and gender budgeting and how they're related. I'm going to give you a brief overview of the Australian National Breastfeeding Strategy. I'm going to talk about the gender budgeting and breastfeeding webinars and the program and the content of the program. And I'm going to talk about some of the progress we've made, including the awareness, advocacy and action, which shapes the WBTi Australia activity. And I'll introduce you also to the team and talk a little about what we've got in mind next. So these webinars were motivated by the fact that an Australian National Breastfeeding Strategy was announced in 2019, but no funding was specified. This risked repeating previous experience which failed to deliver, having no specified funding or implementation plan. Since 1981, the member states of the United Nations, including Australia, have endorsed several human rights instruments. Obligations arise when countries endorse human rights treaties, which include applying maximum feasible resources to realising those rights. According to UN human rights experts, breastfeeding is a human rights issue for both the child and the mother. Our webinars have been about women's human rights and gender budgeting and what this means for resourcing of breastfeeding protection, promotion and support programs and policies by governments. Resourcing is interpreted expansively to encompass human, technical, organisational, natural and information resources. So the National Breastfeeding Strategy was announced in 2019. The World Breastfeeding Trends Initiative Australia was cited, and their report was cited as the international benchmark in the National Breastfeeding Strategy. WBTi Australia was formed at the ANU in 2018 to assess Australian breastfeeding policy and to advocate for improvement. Its report conducted the first explicit gender analysis of breastfeeding policy and its funding. An ANU-led team prepared the evidence review that informed the development of the Australian National Breastfeeding Strategy. So we've got a keen interest in it. The ANU, in partnership with the World Breastfeeding Trends Initiative Australia and the Save the Children UK, convened a conference for April 2020. The aim was to apply gender budgeting approaches to analysing the Australian National Breastfeeding Strategy, its processes and pathways, and its resourcing. This was reconfigured as a webinar series due to COVID-19. The first webinar addressed emergency planning for infant and young child feeding. This is a key action area of the Australian National Breastfeeding Strategy. We also had another webinar focusing on that topic, given its importance at this time. Subsequent webinars address gender budgeting for Australian national breastfeeding strategies in the areas of maternity services, maternity protection, ending inappropriate baby food marketing, and mother-to-mother breastfeeding support. As you can see here on the ANU Gender Institute website, the topics are broad-ranging and were spread over the whole year. We had experts in breastfeeding, gender budgeting, health and economic policy, drawing on global experience, including from countries in South and East Asia, the Middle East, Europe and Australia, to apply the World Breastfeeding Trends Initiative lens to Australian policy. More than 550 different individuals registered for these online events, many attending all or most of the 8 webinars. In total, there were around 1,000 registrations for the series. People from a great diversity of sectors, affiliations and geographic locations participated, and many joined us for the workshops that we conducted to follow up the webinars. Some of those attending were health workers, others worked in the NGO sector, and we also had policymakers in health and emergency services and academic experts in gender analysis and breastfeeding participating in the webinar series. The webinars were all recorded, and along with copies of the PowerPoint presentations are uploaded onto the website of the ANU Gender Institute. So the first webinar introduced the concepts of gender responsive budgeting and explained the World Breastfeeding Trends Initiative and the World Breastfeeding Trends Costing Tool. And we also summarised the key action areas of the Australian National Breastfeeding Strategy. This webinar involves speakers from universities, non-government organisations and government. The second and third webinars focused on optimal infant and young child feeding in emergencies and disasters. It looked at the gaps in planning and provision for supporting women and children in optimal feeding during emergencies and disasters. This included country case studies from around the world. It also included the emerging issues of gender budgeting and breastfeeding during the COVID-19 emergency response. Many speakers were from NGOs involved in humanitarian responses on the ground. The fourth webinar examined the needs for data and dollars for any effective implementation of policies and programs, and highlighted the importance of gender budgeting approaches and the availability of relevant data for analysis, monitoring and evaluation. Speakers brought academic and practitioner perspectives from political science, economics, sociology and public health. Maternity services and milk banking were identified as key areas where resources are critically urgent to support breastfeeding in Australia. These were areas identified as priority action areas under the Australian National Breastfeeding Strategy. However, during the COVID-19 emergency, budgets and health resources for breastfeeding support have been withdrawn within the healthcare system, and new barriers created for women and babies to breastfeed. Perspectives of academics, NGOs and advocates and healthcare practitioners were presented at this webinar. Balancing the demands of employment and unpaid household work affects men and women differently, and insufficient measures to support breastfeeding women, children and families contributes to gender economic inequalities and premature weaning onto commercial baby foods. Speakers with expertise in the political economy of nutrition, the sociology of work, gender budgeting, and on implementing breastfeeding-friendly workplaces and childcare programs addressed the Australian National Breastfeeding action areas in this webinar. Mother-to-mother support was the topic of the 7th webinar. Social movements during the 1960s and 1970s led the return to breastfeeding in Western countries. Mother-to-mother support is invisible and under-resourced and represents a cultural heritage of women's knowledge and skills about breastfeeding that is difficult to replace or restore if it's lost. Representatives of women's breastfeeding support groups from around the world spoke from academic, government and NGO perspectives on creating a supportive community, one that enables women and babies to breastfeed without reinforcing social and gender inequity. The 8th webinar was on conflicts of interest and commercial influence on infant and young child feeding. Trust in the integrity and quality of healthcare is eroded by conflicts of interest and commercial influences on infant and young child feeding practices and policy. Health professionals play a crucial role, but breastfeeding is undermined by lack of government and health system investments, including to address unethical policies and practices in areas of scientific research, policy and guideline formulation, health professional education and training, and health facility procedures and practices. Academics, NGOs and health practitioners highlighted the challenges for breastfeeding when the food industry influences research, policy and guidelines, and health professional practice. We have made considerable progress during and through these webinars. As you can see in this slide, the activities of the webinars generated a call for action on infant and young child feeding, which was supported by around 40 Australian organisations. We've also made multiple submissions, including to the Bushfires Royal Commission, the COVID-19 response inquiry, and budget consultations for 2020, 21, 22. We've made submissions to the Australian Competition and Consumer Commission and on the marketing regulation of marketing of breast milk substitutes, and to the Victorian Parliamentary Inquiry into gender responsive budgeting. Our workshops and background papers have helped inform advocacy in these areas. And our awareness raising has occurred not only through presentations to conferences, but through correspondence with parliamentarians and so on. Here's the team that have done such fabulous work over this time at a number of universities and through a number of NGO actions. The partnership of 3 universities led by the ANU and several NGOs led by WBTi Australia and IDFAN and Save the Children UK were the key partners in this initiative, but also we were supported by academics and NGOs and government departments from numerous other organisations. So what next? Well, following through from the gender budgeting and breastfeeding webinars, we've organised an independent dialogue within the UN Food Systems Summit, where we'll consider breastfeeding as a food system. As usual, breastfeeding is invisible in the international discussions to date, and we aim to make it more visible with various perspectives from the viewpoint of the environment, women, babies, children, and improving resilience to climate change. We also have plans for another webinar, which is focused on how federal arrangements and crisis management systems have impacted Australia's management of maternity services and infant and young child feeding support during the COVID emergency of 2020. So I hope you've gained some information from this presentation, which is of interest to you. And on the screen at the moment, you can see the website where you can review the recorded audio presentations on the webinar series, and also download the PowerPoint presentations and other resources. Thank you for your interest.